and welcome to the video. My name is Emily Abbots, and in this presentation, I will be giving a thorough analysis of the drug oxycodone, better known by its brand name, OxyContin. First things first, let's talk about what is oxycodone. It is important to note that oxycodone is a DEA Schedule II controlled substance, meaning that it has a very high potential for drug abuse and addiction. Furthermore, oxy is a semi-synthetic analgesic opioid, aka oxy and heroin fall within the same drug class. Thus, it is no wonder why oxycodone is one of the most commonly abused prescription drugs in the United States. It is most often prescribed for chronic to severe pain. Moving on to where does it come from? Oxycodone is derived from the opium of poppy plants. It is made by modifying thebaine, the organic chemical found in opium. There are several ways in which oxycodone can enter the body. Recommended methods of use are prescribed orally as immediate release tablets, better known as brand names Oxaydo and Roxicodone, extended release tablets, better recognized as OxyContin, capsules, and solutions. Other methods of use not recommended by doctors include snorting, injection, and smoking. How does it work? Opioids attach to proteins called opioid receptors on nerve cells in the brain, spinal cord, gut, and other parts of the body. When this happens, the opioids block pain messages sent from the body through the spinal cord to the brain. If you refer to the picture on the right, you will notice that it includes the onset period for each method of administration. For example, ingesting oxycodone orally will result in a 10 to 30-minute waiting period, whereas smoking only requires 10 seconds before the drug reaches the bloodstream. Now let's talk about what it does. Oxycodone provides instant pain relief, produces intense levels of euphoria, provides feelings of pleasure and contentment, soothes mental discomfort, and induces calmness. Moving on to the side effects of oxycodone. Among these are drowsiness, headache, dizziness, tiredness, constipation, stomach pain, nausea, and vomiting. When talking about signs of abuse, some symptoms are more noticeable than others. Nonetheless, symptoms include itching, dilated pupils, poor grooming or lack of hygiene, becoming secretive about one's whereabouts, drug driving, and short attention spans. Even more serious than signs of abuse are signs of an overdose. Among these are pinpoint pupils, nausea, low blood pressure, respiratory arrest, sweating, confusion, and blue-tinted fingernails and lips. Here we have a diagram representing each area of the body as well as the ways in which they are affected by oxycodone. For example, side effects of oxycodone can result in hoarseness, swelling, and difficulty swallowing in the throat, hives, rashes, and sweating of the skin, and hallucination, confusion, fainting, and dizziness in the brain. Physical health risks associated with the use of oxycodone can be fatal. Risks include heart disease, liver and kidney failure, addiction, seizures, overdose, an increased risk of tetanus or infection if using injection method, and an increased risk of hepatitis B, C, HIV, and AIDS if using a shared needle. Psychological health risks, on the other hand, include anxiety, depression, moodiness, hallucinations, and clouded judgment and poor decision-making. Moving right along, the long-term damage of oxycodone abuse includes mental health issues, gastrointestinal tract issues, liver damage, kidney damage, sleep apnea, respiratory distress, sexual dysfunction, and many others. Furthermore, the long-term damage of oxycodone use could look like chronic breathing trouble, chronic muscle weakness, dental issues, cold or clammy skin, menstrual issues, and decreased testosterone. I also wanted to include this infographic on the adverse effects of oxycodone because I think it does a good job highlighting the main facts about the drug. Lastly, I would like to discuss withdrawal. Symptoms of withdrawal arise within 8 to 12 hours of the last dose. However, less frequent users may experience less intense withdrawal symptoms than chronic users. Symptoms can last anywhere from a few days to a week, but in most cases, they peak within 72 hours and gradually subside from there. As I stated before, the duration of the withdrawal is determined by several factors. Among these are how long the individual has been using the drug, how much they took, how frequently they take it, whether or not they've mixed it with alcohol or other drugs, their mental health and medical history, and how they took it, whether it be snorting, injection, or smoking. Finally, we've reached symptoms of withdrawal. Symptoms of withdrawal include fatigue, coughing, runny nose, teary eyes, shaking, poor concentration, mood swings, and the inability to feel pleasure. This concludes the presentation. Thank you for watching my video, and I hope you learned something new about oxycodone.